Hello, my name is Amir Aran, MD. I'm an orthopedic surgeon, a hand surgeon, and a microsurgeon. And today we'll be talking about ulnar neuropathy or cubital tunnel syndrome. First, a disclaimer. This is not medical advice. If you are seeking medical advice, please contact a professional wherever you live around the globe. This is, however, some information for you to use, and maybe you can apply it in your everyday life. But once again, if you do need medical advice, please contact a professional, preferably a hand surgeon. Cubital tunnel syndrome has to do with pressure over the ulnar nerve, which traverses the cubital tunnel, which is right here. What you will feel as a patient is numbness and tingling in your fifth, the smallest, the pinky finger, and the finger next to it, about half of it. You will also usually feel some weakness in that hand. You will many times feel that the hand is not as strong as it used to be. You might find that some of the tasks you found quite easy, like holding a hammer, are quite hard at this point, and you might even find yourself dropping the hammer or dropping whatever you use. Cubital tunnel syndrome can be caused by local trauma, or by repetitive movements, or idiopathic reasons. In essence, what it says, or what it means, is that there is compression over the ulnar nerve, which goes right here. This is your medial epicondyle, where you might have golfer's elbow and medial epicondylitis, which is actually the same. And the ulnar nerve goes right behind your epicondyle right here. One of the ways to assess it is if you go like this, you have the funny bone, as we call it. And if you find that there is numbness and tingling happening here, or quite pain, and you feel sudden lightning strokes going down your hand, you might have cubital tunnel syndrome. This might also come with intrinsic cases where there will be loss of the intrinsic muscles in your hand. You'll find there's a small hole here, and the hands don't look exactly the same. You might find clawing of your fingers, especially the fifth and fourth finger. And you also might find that you are not, or it's very hard for you to pull in the fifth finger next to the other fingers, or that you are using your flexor in order to close your first web right here. All these symptoms might come with a compression of the ulnar nerve in this area. Treatment, or actually the assessment initially, will be done by electromyography, EMG, where the nerve conduction velocity at the elbow level will be assessed, and in cases of cubital tunnel syndrome, this will be slowed down. There will be slowing of the nerve conduction velocity of the nerve in this area. In these cases, one will assess and decide whether the recommendation is to do conservative treatment or opt for surgery. Conservative treatment might include physiotherapy, rehabilitation of the nerve, doing some mobilizations of the nerve, and other modalities, maybe a splint. If this fails, surgical intervention is the case, and then several surgeries are optional in this case. You can either do surgical release of the nerve itself. When it is stable, this is the one that I recommend the most. You will usually use a very small incision, go over the nerve, and release it. You can also transpose the nerve either subcutaneously, intramuscularly, or submuscularly in the elbow lesion. Some might even take off the epicondyle, which is the bony protuberance here. In these cases, all of these surgeries are possible surgeries to treat cubital tunnel syndrome. Cubital tunnel syndrome is not as common as other symptoms or that you might find, like carpal tunnel syndrome, but cubital tunnel syndrome is there, and it may cause wasting of the muscles in your hand. If you do have, or suspect you have, cubital tunnel syndrome, please go to a professional anywhere you are around the globe and seek medical advice. Thank you very much. I was Amir Aran, MD, orthopedic surgeon, hand surgeon, Capital Medical Center. Thank you.